Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, again, thank you so much for joining us.
Well, thank you once again for having me in this program.
Yes, sir. Let's begin with the campaigns that you currently have in some of the regions. I know in particular Region 7.
Yeah, well, since last Thursday, we had a team that went into a number of areas in Region 7, and they would have met with the residents there. The team was a broad-based team. They had medical personnel, they had some persons from the joint services, and they met with the residents, and those who were exhibiting any signs or symptoms, they were able to do some testing for them. As a result of which we have seen a number of cases now in Barometer because of the work that we have done there and the outreach that we had. And we are going to continue to look at areas of interest and repeat the same exercise, because the normal way of how we treat and gather information, sometimes we don't have enough persons in particular areas, but we might have an interest in those areas because of some of the trends that we are seeing. So we are now developing these teams that we can deploy to those areas and get a better sense of what is happening. And in this last deployment that we had, we were able to use some of the rapid kits, and they've worked very well. And we also included, in addition to the rapid kits, we've included PCR testing as well. So the combination of the two has really given us a good assessment of the epidemiological situation in those areas.
All right. And yesterday you mentioned that they had some cases you were looking at in Region 6, I think, and then previously, I think you had said Region 10.
Yeah, well, we continue. Region 6, we had a spike maybe about a week or two ago, especially in the New Amsterdam area, but most of those persons have since been discharged. We still have active cases in Region 6, but it's not as much as we had maybe about a week ago. We have a number of cases in Region 10, and we are monitoring a number of communities where we have seen in one particular community about 23, another one about 15. So there are pockets of places in Region 10 where we have seen this spike of cases. So those that we have identified using PCR, we are going to continue to have them in self-isolation and monitor them.
Okay. Seeing that you're doing we've started the antigen test, you mentioned for Region 7, how has it been across the board though, in terms of the other facilities?
Their rollout, well, as you know, we have trained people in all the regions to do the rollout, and we are going to, I think we are getting faster turnaround. As you know, these things take about 30 minutes to do. The challenge, however, is that if the person returns a negative antigen test, well, then we want to do a PCR test just to make sure. We have been using that protocol, and in that way we are able to quickly identify people. With the PCR, however, you'll have to send that back to the lab, so that takes a little bit longer. But by and large, a lot of the people who we have tested with the antigen tests, we can get a faster result. It works quite well in hospital setting, especially for persons who are, having some symptoms. And we have been able to pick up a lot of positive using this test in hospital settings.
Okay. Initially when we spoke, you had indicated with the move over to the Lilienthal Hospital that services would have gotten back to normal at GPHC. How is that going?
Well, they're returning that service more or less to some level of normalcy, with, of course, the precautions of COVID-19. So they have an active outpatient clinic. They're planning now to open up back the surgical suite so they can do more than just emergency surgery. So all these things they're working on right now. We haven't been able to move over our maternal cases because we would require to have a birthing area. And so those cases, even if they test positive for COVID, are still at the Georgetown Hospital, but they're in a different section of the hospital. That does not interrupt the other areas where we need to do internal medicine or surgery or those sort of things.
If we can shift now to vaccine just for a little bit. I know we still have to go through the COVAX. Well, we're going through the COVAX facility, and we're still waiting until that is decided upon. But I know there's good news with Pfizer vaccine. Could you share your thoughts on that?
Well, Pfizer vaccine has been the first one to be approved. The UK, as you know, would have given that emergency use authorization, followed by the United States and Canada. And very shortly, the European Union is set to approve the vaccine. So the developed countries have been, their regulatory bodies have looked at the vaccine, analyzed the data that has been presented, and has given authorization for the use of the vaccine. This vaccine is going to be used for people 16 years and above, and it has now been rolled out in a number of countries, or is in the process of being rolled out in the UK, in Canada, and in the US. And I suspect once the Europeans have approved the vaccine, that it would also be rolled out there as well.
Bringing it back to home a little bit, we know that a lot has been happening in terms of updating our own medical facilities. When last we spoke about Diamond, and it should be completed as a smart hospital. Could you give us an update on Diamond and those other facilities that are currently being, I think Lenora was the last one, and then there's Mabaroom and so on?
Well, we have a number of infrastructure projects that are ongoing in the ministry. We have under the Smart Hospital project, we have Diamond. And at Diamond, we are almost complete with the building. We are expecting that either by the end of this month or maybe in mid-January, that the building per se would be handed over. However, they will still have to do some works in and around the compound of the Diamond Hospital. But so far, our team that has been monitoring the works, they're quite pleased with what we have seen so far. And I think when patients visit, they too would be very happy with the new facilities that they will be using. So we are expecting, as soon as that is handed over, that we can put that back into operation. But in addition to Diamond, we have now started at Lenora, and we have been working out a schedule with the contractors so as to have minimal disruption of services at Lenora. They have, as you know, a year to complete all the renovations, but we have been assured that they will be able to do that before time. A contract has also been signed with one of the contractors for Mabaruma, but the contractor has not started as yet, and this is something that we are concerned about, so we have flagged that with the relevant authorities pertaining to this particular contract. LETEM, another project that we have, that is ongoing, and we'll continue to monitor that as well. And early next year, we expect to have the Paramakatoi Health Center being upgraded. In addition to that, we have, through funding from the IDB, we are looking at the building out some maternity homes. So one of the maternity home that we have started to construct is in LETEM. And this is going to expand the services that we are currently offering in LETEM. So that project was started maybe about a month and a half ago, and we expect that it would be completed sometime in January. We have another maternity home that we are looking at on the East Coast. So we are working with the IDB to ensure that we have the right location and so forth. And once we can settle those things, then we'll start the construction of that. So that's a project that you'll see would start next year and hopefully would be completed sometime late in the year. We also have a maternity home or maternity ward that was built at the New Amsterdam Hospital. So that one will, over the next couple of weeks, we'll have to add equipment and so forth and put it to use. So these are some of the infrastructure projects that have been ongoing. And we are now bringing some of them to closure while others will have to work a couple of months more to make sure that we complete these projects. In addition to these, we have been working with the government of India, and hopefully by first quarter next year, we would see the start of the project to do some new buildings at West Demerara Hospital, Suddy Hospital, and Bartica. So these are going to be new projects that would be coming on stream next year.
Okay. All right, Minister, I wanted to touch a bit on something you addressed yesterday. You spoke about the task force being bombarded with requests to open bars and so on. We touched on it yesterday, but I feel people need to understand the reason why permission cannot be granted, if you will.
Well, it's simple. I mean, if you're in an enclosed environment, COVID spreads by someone who is infected when they speak or, droplets from their mouth and nose can get out, and some of these droplets travel as much as 6 feet. So if you're in close proximity to someone that is not wearing a mask, your chances of getting the infection from somebody who's infected is very high. So that's one reason with the droplets, the spread of droplet from an infected person to someone who is uninfected. The second reason is that if you're in an indoor environment, apart from droplets, there are other small, tiny particles, really tiny, that's called aerosols. Now, they're so tiny that they remain suspended in air for a long time. And therefore, if you had somebody who is infected, these aerosols carry the viral particle in them, and they remain suspended. So if you come into a room where someone who had, who was there with COVID, they sneeze or they spoke in the room, these tiny particles are going to remain suspended in the room for a little bit. So you come in, you don't have a mask on, what is going to happen? You're going to inhale it, so you get infected. And we know that if you're in a bar or in a restaurant, generally for you to eat or drink, you have to take off your mask. And that is why we have been saying to people, you cannot open bars because the possibility, and there's a high possibility that you're putting a lot of people at risk. If we look at what is happening in, say, some of the developed countries, let's look at Germany, for example. Germany, they had an increase in cases, and some of the measures that they have put in place includes closing bars down, closing restaurants down, because they recognize that spread happens at these places. So we have had this in our guidelines for quite a long time, and we have maintained them in our guidelines. Unfortunately, because I think it's the Christmas season, everybody wants to now open up bars, open up restaurants, so that people can go there and eat and have a jolly good time. We're still in a pandemic, and nothing has changed. And therefore, we have to abide by these guidelines. And if we don't, we are going to see spikes in cases as we go later into the month and early into the new year. We can avoid this if we follow these guidelines. So our guidelines are very clear. Bars are not to be open, and that's written in the guidelines. We haven't changed that. And indoor restaurants are not allowed. What we are allowing is if you want to get some food, you can order it, they can cook it for you, you go, you pick it up, and you go your way. If you want to have outdoor dining, there's some regulation that allows for outdoor dining. So we want businesses to be responsible, and that's why we have allowed for this. We don't want to close people down entirely, but at least if we are allowing these types of activities, then please conduct them in the right way, because you're endangering people and you're putting yourself at risk too. Right? So, we just want people to abide and do the right thing so that we all can remain safe.
Okay, Minister Anthony, again, thank you so much for joining us.
Well, thank you very much.
Well, that's it for today's COVID-19 update. We, of course, just spoke with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and, of course, our social media platforms.